Hello everyone, now let us discuss about the diseases and disorders of musculoskeletal system. Coming to the first condition, osteoporosis. Osteo means bones, porosis is becoming porous. Osteoporosis is a condition of porous bones. It affects about 10 million people a year in United States. In addition, 18 million people have low bone mass, that is nothing but osteopenia, which puts them at the risk for osteoporosis. The basic problem is that bone resorption, that is breakdown, outpaces bone deposition formation. In large part, this is due to the depletion of calcium from the body. More calcium is lost in urine, feces and sweat than is absorbed from the diet. The bone mass becomes so depleted that the bones fracture often spontaneously under the mechanical stresses of everyday living. For example, a hip fracture may result from simple sitting down too quickly. In the United States, osteoporosis causes more than 1.5 million fractures a year, mainly in the hips, wrist and vertebrae. It also afflicts the entire musculoskeletal system. In addition to fractures, osteoporosis can cause shrinkage of vertebrae, height loss, hunched backs and bone pain. Osteoporosis primarily affects middle-aged and elderly people, 80% of them being women. Older women suffer from osteoporosis more often than men for two reasons. Women's bones are less massive than men's bone, and production of estrogens in women declines dramatically at menopause, while production of the main androgen testosterone in older men wanes gradually and only slightly. And estrogens and testosterones, they stimulate the osteoblast activity and synthesis of bone matrix. Besides the gender, risk factors for developing osteoporosis include family history of a disease, European or Asian ancestry, thin or small body build, an inactive lifestyle, cigarette smoking, and diet low in calcium and vitamin D, more than 2 alcoholic drinks a day, and the use of certain medications. Osteoporosis is diagnosed by taking a family history and undergoing a bone mineral density study, bone mineral density test, BMD test. Performed like X-rays, the BMD test measures bone's density. They can also be used to confirm a diagnosis of osteoporosis, determine the rate of bone loss, and monitor the effects of treatment. There is also a relative new tool called FRAX that incorporates the risk factors besides bone mineral density to accurately estimate the fracture risk. The patients fill out the online survey of risk factors such as age, gender, height, weight, ethnicity, prior fracture history, parental history of hip fracture, use of glucocorticoids, for example cortisone, smoking, alcohol intake, and rheumatoid arthritis. Using the data, the FRAX provides an estimate of the probability that a person will suffer a fracture of the hip or other major bones in the spine, shoulder or forearm due to osteoporosis within 10 years. The treatment options for osteoporosis are varied. With regard to nutrition, a diet rich in calcium is important to reduce the risk of fractures. Vitamin D is necessary for the body to utilize calcium. In terms of exercise, regular performance of weight-bearing exercises have been shown to maintain and build bone mass. These exercises include walking, jogging, hiking, climbing stairs, playing tennis, and dancing. Resistance exercises such as weightlifting also build the bone strength and muscle mass. Medications used to treat osteoporosis are generally of two types. Anti-reabsorptive drugs slow down the progression of bone loss, and the second is bone building drugs that promote the bone mass, promote increasing the bone mass. Among the anti-reabsorptive drugs are biphosphates, which inhibits osteoclast, and selective estrogen receptor modulators, which mimic the effects of estrogens without unwanted side effects. And estrogen replacement therapy, ERT, which replaces the estrogens lost during and after menopause, and hormone replacement therapy, HRT, which replaces the estrogens and progesterone lost during and after the menopause. ERT helps maintain and increase the bone mass after menopause. Women on ERT have a slightly increased risk of stroke and blood clots. Hormone replacement therapy also helps maintain and increase the bone mass, but women on hormone replacement therapy have increased risks of heart disease, breast cancer, stroke, blood clots, and dementia. Among the bone building drugs is parathyroid hormone, PTH, which stimulates the osteoblasts to produce new bone. Others are under development. Here you can see a comparison of a spongy bone tissue from a normal young adult and a person with osteoporosis. You can find a weakened trabeculae. In osteoporosis, bone resorption outpaces bone formation. So bone mass decreases. This is the normal bone. And here you can see porous. Pores are present in the structure. This is a osteoporotic bone. This is the normal bone matrix and this is the bone matrix with osteoporosis. The next condition is rickets and osteomalacia. Rickets and osteomalacia. Malacia means softness or softening, are two forms of the same disease that result from inadequate calcification of the extracellular bone matrix, usually caused by a vitamin D deficiency. Rickets is a disease in children in which growing bones become soft or rubbery and are easily deformed. Because new bone formed at the epiphyseal plates fail to ossify, bowed legs and deformities of the skull, ribcage and pelvis are common. Osteomalacia is the adult counterpart of rickets, sometimes called as adult rickets. Osteomalacia is the adult counterpart of rickets and sometimes called as adult rickets. The new bone formed during the remodeling fails to calcify and the person experiences varying degree of pain and tenderness in the bones, especially the hip and legs. Bone fractures also result from minor trauma. And prevention and treatment for rickets and osteomalacia consists of administration of adequate vitamin D and exposure to moderate amount of sunlight. Here you can see this is the normal bone, whereas curved rickets or osteomalacia, bent bone you can see. This is the normal bone and this is the person's bone with rickets or osteomalacia. Here you can see normal bone and the hip bone with rickets and bowed legs. Here you can see the knock knees. The next condition is osteoarthritis. Osteoarthritis. Arthro means joint, itis means inflammation. Osteoarthritis is the degeneration of articular cartilage such that the bony ends touch. This resulting friction of the bone against bone worsens the condition. It is usually associated with the elderly. Here you can see this is the healthy joint. This is the cartilage. In osteoarthritis, the cartilage gets damaged. As a result, the bone ends rub together. And this causes friction and pain. This is a healthy joint and this is a joint with osteoarthritis. The cartilage begins to break down. As a result, bone spurs will occur, that is osteophytes, thickened and inflamed synovium, roughened thinning cartilage, and thickened stretched capsule. The joint affected by osteoarthritis. Now coming to the next condition, that is osteomyelitis, an infection of the bone characterized by high fever, sweating, chills, pain, nausea, pus formation, edema and warmth over the affected bone and rigid overlying muscles. It is often caused by bacteria, usually Staphylococcus aureus. The bacteria may reach the bone from outside of the body through open fractures, penetrating wounds, or orthopedic surgical procedures. From other sites of infection of the body, for example, abscessed teeth, burn infection, urinary tract infection, upper respiratory tract infections via the blood, and from adjacent soft tissue infections as that occur in the diabetes mellitus. Here you can see softening of the bone tissue occurs in osteomyelitis. Infected area, you can find the Staphylococcus aureus. This is the most common organism seen in the osteomyelitis. Here you can see a small abscess is formed in the cortex. In this case, this is the next progressed stage, enlarging abscess. And you can finally see sequestrum, a vascular necrotic region. Pus escapes through the sinus tract. The next condition is osteopenia. Osteopenia is nothing but deficiency. Penia means deficiency. Reduced bone mass. Osteopenia is reduced bone mass due to decrease in the rate of bone synthesis to a level too low to compensate for normal bone resorption, or any decrease in bone mass below normal. An example is osteoporosis. So osteopenia occurs in osteoporosis, that is reduced bone mass. Here you can see this is the healthy bone and this is the osteopenia, bone affected with osteopenia. The next condition is osteosarcoma. Sarcoma is nothing but a connective tissue tumor. Osteosarcoma is a bone cancer that primarily affects osteoblasts and occurs most often in teenagers during their growth spurt. The most common sites are the metaphysis of the thigh bone, shin bone, and arm bone. Metastasis occurs most often in lungs. Treatment consists of multi-drug chemotherapy and removal of the malignant growth or amputation of the limb. Here you can see this is the osteosarcoma and this is the patella kneecap. Osteosarcoma in cut. This area is the osteosarcoma. This is the normal bone. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.